Dr. Meschino, I really have a problem with going to sleep at night, and I hate the fact of taking any type of medication or any pills to get some rest. Could you tell me, or could you give me any advice on how to get some rest without sleeping pills?
Well, insomnia actually affects 15 to 30% of all adults. It's the second most common health problem after pain. And 50% of people who have insomnia seek medical help due to the seriousness of the problem and how much it actually interferes with their life. But in my view, it's better not to use sleeping pills and rather to use more natural methods. You see, sleeping pills have addiction potential, and other side effects have come to light in recent years as well. So in this video, I'm going to share with you the best proven and safest natural sleep aid remedies. So the first one to know about is melatonin, and I say that because it's often the underlying problem. So as we get older, melatonin levels drop off. The pineal gland secretes less of it as we get older. So normally at dusk, the pineal gland secretes melatonin. It helps us get into a deep level of sleep and achieve not only a deep level of sleep, but really renew us so we wake up refreshed. After age 13, there's a decline in the secretion of melatonin from the pineal gland. So by the time we're 40 years old, our melatonin levels are 50 to 60% lower, and they continue to decline as we get older. And the result of that is that we have a more difficult time getting to sleep, remaining asleep, and reaching deeper levels of sleep. And so to really wake up refreshed, you have to have all these three things happen. You have to get into that deep level of sleep and stay there long enough to be refreshed and rejuvenated. Melatonin also protects the brain against free radical damage. Free radical damage to the brain is linked strongly to Alzheimer's disease and some other problems. So quenching those free radicals in the brain is very important. Melatonin also enhances immune system function, and it's linked to a reduction in risk of breast and prostate cancer. So melatonin supplementation makes really good sense to me. I use it myself, but I use it in conjunction with three other natural agents, all in the same capsule: 5-HTP, GABA, and Bacopa monnieri. Let's talk about those three. So 5-HTP is 5-hydroxytryptophan, which when you take it as a supplement, the brain converts it into melatonin and then into serotonin. With higher serotonin levels, you improve sleep quality. You can get to sleep more easily. It also curbs appetite, so you tend to avoid weight gain as you get older, and gives you some mood elevation. With GABA, GABA is GABA-aminobutyric acid. The brain normally makes GABA, but if you give your body a little more GABA, it helps to stimulate the GABA receptors, which induces relaxation, decreases stress and anxiety, and it enables you to get to sleep more easily. And then the third supplement, Bacopa monnieri, is actually an Indian herb that's been used for a long time to improve brain function. It helps to quench free radicals in the brain like melatonin to stop free radical damage, but it's also been shown to preserve memory and to enhance memory even as you get a little bit older. So adults should pay attention to that. Now, because free radicals do so much damage to the brain, they're linked to Alzheimer's disease, Parkinson's disease, multiple sclerosis, Lou Gehrig's disease, and other brain pathologies that are related to the aging process. So things that can quench those free radicals like melatonin and Bacopa monnieri are really a big advantage to taking a supplement like the one I'm describing. So I really like the combination of, all in one capsule now, melatonin with 5-HTP, with GABA, and Bacopa monnieri. I take that combination 1 hour before bedtime so it has a chance to get into the bloodstream, cross the blood-brain barrier, and have that effect. Now, that combination to me gives you a big advantage over synthetic sleeping pills, because with that natural agent combination, there's no dependency or addiction potential. It acts as a brain antioxidant. Sleeping pills don't do that. May help to reduce the risk of breast and prostate cancer. At least the melatonin factor is in that way. There's a doctor in Italy called Dr. Lissoni who uses high doses of melatonin as part of the adjunctive treatment of breast and prostate cancer. That's how effective it might be. Also, you're getting the immune system modulation effect, which is very positive. And with higher serotonin levels, it helps to suppress appetite, gives you mood elevation, and better sleep quality. And also better memory preservation with melatonin and Bacopa monnieri. So I like all these things working synergistically. If pain is keeping you awake at night, I'd suggest that you look into the California poppy. I have a video on this site about chronic pain that features the California poppy supplement. You should look into that. Now, behavioral therapists talk about other things that are important to get a good night's sleep. That is, Go to bed only when you're sleepy. And remember, the bed is only for sleep and sex. It's not for watching TV and eating and reading. You should use your bed for sleep and sex primarily. And try to establish regular wake sleep cycles. So you're going to bed roughly at the same time so your body gets into a natural rhythm. And also, body-mind exercises, meditation, yoga, deep breathing, progressive relaxation can help you unwind at the end of the day naturally as well. And regular exercise, endurance exercise in particular, helps to, over the long run, produce full body fatigue, lowers adrenaline levels. Just don't do your exercise late at night when it might actually, reawaken your brain to a degree that would decrease your ability to get to sleep. So those are my best tips on this subject. I hope you found them helpful. I'm Dr. James Meschino. Thanks so much for watching.